Let's continue seventh part of this series. First drug is methotrexate. Methotrexate inhibits the hydrofolate reductase, the enzyme that transforms folic acid to the active form, resulting in decreased DNA synthesis. It is a chemotherapeutic agent used to treat a variety of malignancies, for example, all lymphomas, breast cancer, head and neck cancer, osteosarcoma, choriocarcinoma. Immunosuppressant used to treat many autoimmune disorders, for example, RA, Crohn's disease, scleroderma, psoriasis. Side effects are bone marrow suppression, nephrotoxicity, may crystallize in renal tubules, hepatotoxicity, steatosis, teratogen, pulmonary toxicity, mucositis, seizures, GI upset, alopecia. Next drug is nifedipine, also called the hydroxypyridine calcium channel blockers. It is a calcium channel blockers act by blocking the voltage-gated L-type calcium channels of cardiac and vascular smooth muscle. This class of drugs is used in the treatment of hypertension, Prinzmetal angina, and Raynaud's disease. The side effects are hypotension and peripheral edema. Next drug is glindamycin. Glindamycin is a protein synthesis inhibitor. It binds the 50S bacterial ribosomal subunit and acts to inhibit the formation of the initiation complex. Glindamycin is effective against some anaerobes, for example, Bacteroides fragilis, Clostridium perfringens, as well as against some gram-positive cocci, streptococci, staphylococci. Side effects are pseudomembranous colitis, Clostridium difficile overgrowth, nausea, diarrhea, skin rashes, impaired liver function. Next drug is baclofen. The exact mechanism is unknown, but baclofen may work to reduce reflex muscle activation by hyperpolarization of afferent pathways, used to treat muscle spasm. Side effects of baclofen are hypotonia, drowsiness, GI upset. Next drug is nitroglycerin. Nitroglycerin is converted to nitric oxide intracellularly. Nitric oxide acts to stimulate guanylate cyclase, thereby increasing cGMP synthesis. Elevated levels of cGMP leads to dephosphorylation and deactivation of myosin light chain, which thereby results in smooth muscle relaxation. Used in the treatment of angina, pulmonary edema, hypertension, and heart failure. Side effects: transient compensatory tachycardia, headache, due to dilation of cerebral vessels, orthostatic hypotension. Next drug is valycyclovir, from a class of acyclovir. Acyclovir is phosphorylated by viral thymidine kinase into an off-action analog of DGTP. After conversion, the drug acts to inhibit DNA synthesis. Acyclovir is used to treat genital herpes, herpes meningitis and encephalitis, acute varicella zoster virus VZV infection, and oral hairy leukoplakia, associated with EBV infection. Side effects are nephrotoxicity, may crystallize in urinary tract, neurotoxicity symptoms like tremor, delirium. Next drug is morphine, opioid class. Work by binding to specific opioid receptors result in activation of these receptors results in the hyperpolarization and decreased activity of neural cells. This opioid is primarily used for pain control, acute pulmonary edema and ischemic pain during myocardial infarction. Side effects are cardiac and respiratory depression, constipation, meiosis, nausea, urinary retention. Next drug is enalapril. This is a ACE inhibitors act by inhibiting the angiotensin converting enzyme. By decreasing the levels of angiotensin II and increasing the levels of activated bradykinin, the ACE inhibitors act to decrease peripheral vascular resistance and to decrease the effective circulating volume of fluid in the body. This drug used in the treatment of hypertension, congestive heart failure and diabetic nephropathy. ACE inhibitors have also been shown to decrease mortality in post-myocardial infarction patients. Side effects are dry cough, and this is due to increased bradykinin, hyperkalemia and renal failure in patients with renal insufficiency, Hypotension, teratogen, may cause fetal renal damage, and angioedema. Next drug is donepezil. Donepezil acts to reversibly inhibit acetylcholinesterase in the synaptic junction, thereby resulting in increased stimulation of both nicotinic and muscarinic receptors. Used in treatment of Alzheimer's disease. Side effects are nausea, dizziness, insomnia. The next and last drug is propofol, which is general intravenous anesthetic agents. Mechanism of action is unknown. It used for induction and maintenance of anesthesia and conscious sedation. Side effects are hypotension, chemical pancreatitis. Thanks for watching.